This is Dr. Ben Pearl with FitFootU. So today we are looking at a case of a foot drop injury from an ankle sprain. So sometimes what happens is the peroneal nerve, as it wraps just behind the fibula in the knee, will be traumatized, resulting in a foot drop like we see over in the picture here. Now, what does that foot drop mean? It means that it's very hard to lift up the toes, okay? So what's the reason? Sometimes there'll be resultant scar tissue that hooks up on the peroneal nerve as it crests around the fibula head up in the knee. And sometimes it's the result of just an engorgement of the nerve. So if there's an engorgement of the nerve, how do we deal with that? What is a way we can non-surgically address that? Well, one way is with something called pulsed electric magnetic field. And what that does is it engages the nerve, it stimulates the nerve, it helps with cell permeability to improve the condition and the status of the nerve, thereby helping to fire the nerve more effectively. We're going to look at an example of a patient that has sustained that foot drop injury 3 months ago. And nothing has really improved it except for the fact that now we are waking up the nerve with the PEMF treatments. I'm going to shift over and segment the treatment that he did, and we'll look at the current state of his dorsiflexion or ability to move the toes upward. So here's the key find. Even though it doesn't look like a lot, my patient was not able to do that last time. I'm going to let you sort of describe it in your words, this wake-up process, what you've experienced from treatment number 1 now to treatment number 2. And we did run it, by the way. We ran that PEMF all the way down to the length of the peroneal into the ankle as well.
So the first time I was here, I could not move my foot at all up, and I felt no control at all of my toes moving up. And when I had this treatment the first time, I didn't have the same sensation that I had the second time, and now I can see, I guess these are tendons being activated when I try and move my toes up. There's not a lot of movement, but this is, compared to what it was last time, this is giving me hope.
Yeah, and that's great. You know, these things, as we mentioned, by their normal healing trajectory can be up to 2 years to heal. So it's already been 3 months for you, and we're hoping that with this jump start of sorts, we're going to shrink that hopefully to just a couple more months. So the real question is, what do we do with frequency? I'm going to suggest we try to see if we can engage this twice a week if possible. And then we'll talk about some other options if it, particularly since we've had some early significant success. I mean, to me, this is like at least about 20% to 25% better than where you were, which, for slogging on with no change is a big delta.
Mm-hmm.
All right, we'll continue to follow up.
That does look better. Less of a giddy up for sure. That is good.
And you're noting less tripping. Very good.